for coming. And I see many of you are still coming in, so that's wonderful. But most of all, we want to thank Dr. Cope for being here today. Dr. Cope is our medical director, and he's absolutely wonderful. He's been with us for several years in this role, and we've also worked with him for several years prior. He's here to talk to us this morning about COVID-19, the vaccine, and any other question you have that pertains to COVID-19, and perhaps any other question too. We appreciate you, Dr. Cope, taking your time to meet with us this morning. We appreciate all of you coming to join. It's wonderful. We only wish we could be in person, but you know, we know the reality of timing right now.
Yeah, and thank you for having me this morning. And it's great to see so many people in on the conference. And then I believe we're also taping it, right? So the people who can't see it, couldn't log in now, will be able to watch it later. So that's great.
So a little bit of background on Dr. Cope, aside from what he does here with us. He's a board certified family physician, and he has a practice in the Broad Alban, Vales Mills area. He's also a physician advisor in quality management for St. Mary's in Amsterdam. And several of you know this, he regularly leads medical teams to Honduras with the Rice Foundation. And he's also on a number of board of directors locally, including Mountain Valley Hospice and the Palliative Care Team, Catholic Charities, the HMFM Prevention Council. So he's an extremely well-rounded person. Just one thing for housekeeping a little bit today, because there's several of us on here. So if you can just make sure you stay muted, and when you have a question, we'll be able to unmute you. You can do two things. You can raise your hand, but sometimes it's hard to see with a number of us on the screen. So if you can go into the chat button and send in your question there, we'll get to it. We do have some questions that were submitted beforehand by people, so we'll go through those as well, but feel free at any time to jump in. Okay, so Dr. Cope, would you like to say a few things before we get to the questions?
Sure. I think one of the reasons we're having this today is I think you've been following the news with this Delta variant of COVID that is now prevalent in our community. It's come very quickly. The Delta variant actually started in India probably about 8 months ago and rapidly spread through the world. It's a much more contagious variant of COVID. It's actually about 60% more contagious. They say there's like 100 times more virus in your nose when you have the Delta variant. So it's spreading very rapidly. New York City early in the summer hit the halfway point with Delta because the Department of Health actually tests COVID. They're the only ones that can do that. They test for the variant, and it hit 50% early June, and now it's about 95%, and it's come upstate into our area. So we're seeing a spike in COVID cases, and if you follow the county statistics, we're actually, over the last week, I was looking this morning, Fulton, Schoharie are hitting over the last week almost 10% positive tests for COVID. And those are basically, all of those are the Delta variant because it's so prevalent now. So that was one of the reasons we wanted to get together. We're seeing a spike like we haven't seen since last winter, since last January. So we want to talk about how we can try and mitigate that, keep it from getting worse, and what we can do about it. So that's why I'm here. So I'm very willing to answer questions.
So what are the things, Dr. Cope, if we could talk about, we've heard, are they testing for the Delta variant? How do we know? Do you want to share that so people understand?
Right. So we have found out it's only the Department of Health in New York down in Albany that can test for the Delta variant. So what they do is they sample the positive tests and they send them down to Albany and they do tests for the Delta variant. So now they're pretty confident that 90 to 95% of the tests that they're running have the Delta variant from all over the state. So it's spread rapidly. So basically now, if you get diagnosed with a positive COVID test, that is, for the most part, 90 to 95% of those are the Delta variants. So we don't have to test for it specifically.
So when we do our testing, so you all know, when we do the rapid testing, we're confirming whether or not you're positive or negative. We don't have the ability to determine whether or not that is the Delta variant. And when we do the ones where occasionally what they call the PCR, which is the utmost of sensitive, and we send those out to the lab, those as well, we do not get the Delta variant on. So just so you know, as Dr. Cope is saying, we're presuming basically everyone that's positive is the Delta variant.
Right.
So one of the questions that we know that a lot of people have is, we were vaccinated, but we're hearing that some of the vaccinated people are positive. Do you want to speak to that, Dr. Cope?
Right. So what we're finding with this Delta variant is that you can still have a mild positive case of COVID if you've been vaccinated. But the studies we're seeing show that, again, it's going to be fairly mild. You're not going to be hospitalized, much less chance of dying from a COVID infection if you've been vaccinated. So that's the good news. The bad news is that we are seeing some of these, what they call breakthrough infections on the Delta variant. So, I'm talking to people every day now recommending that even if you've been vaccinated and you're out and about in the shopping centers and any type of indoor space where, it may be hard to maintain social distance from people, I recommend, and people are recommending now, that you once again put the mask back on. We thought we were done with them, but we're not done with them. So they will offer you some protection against the Delta variant, and even if you've been vaccinated. But the good news again is if you've been vaccinated, you would get a much more mild case. The studies are all showing that.
Thank you, Dr. Cope. But to share, Dr. Cope is aware we had a recent situation in one of our homes earlier in August where it started with one employee that had started with some symptoms and I didn't think they were much and didn't report them on the screening. And unfortunately, the outcome there was we had 3 employees end up being positive and 7 of our folks at the home. The folks at the home were all vaccinated. Most of them had mild or no symptoms. One of the gals in particular was hospitalized with pneumonia, but she wasn't sick like we've seen people sick before. So we were very grateful for that. So we think that obviously the vaccine played a role in that and helping them stay well during this difficult time. So,
Right.
Dr.
Yeah.
Cope,
I was looking at the data. The hospitalizations right now across the country yesterday hit 95,000. So we had peaked in January at about 125,000. So we're climbing rapidly towards that peak again of that 125,000. So that means that 95,000 people are in the hospital with COVID in the country. 25,000 of them are actually in the ICU on ventilators. So about, 1 in 4. So it's rising rapidly. And what they've shown time and time again, and all the hospitals are reporting this, is that 90 to 95% of those people in the hospital and on those ventilators are unvaccinated people. So, and it's the same with the deaths. Unfortunately, yesterday we lost almost 1,400 people in the country to COVID, and that's the weekly average. So almost 10,000 people this week died from COVID, and 95% of them were unvaccinated. So, the vaccines do work. We recommend them. We believe they're safe, and we encourage people to get them. And I know it's an individual choice at this point, but I encourage you to put politics aside and look at the science, look at the data, and encourage you to get vaccinated.
So, Dr. Cope, one of our questions was if someone had received, it was either the Moderna or Pfizer, the 2 vaccine series, if they had received one vaccine but not the second, what can they do now?
Yeah, the recommendation is to get the second one. If you missed your second dose appointment, maybe you were sick, something came up, you were traveling, whatever. The recommendation is to get the second shot as soon as possible. And that will complete your series. You won't need another. That will complete your 2-shot series. Now, the booster we can talk about because I'm sure people are hearing about the booster coming this fall. And we're waiting for the CDC and the federal government to approve the booster. They have approved it for immunocompromised people. So, for example, if you're on a high dose of steroids, prednisone, you, as of, I believe it's as of today, you can go to, it's September 1st, you can go to a pharmacy and request a booster shot. The booster is the same shot that you got back, when you had your original series. It hasn't changed. They haven't modified it. It just boosts your immunity to COVID and especially to the Delta variant. So that's as of today. Now, in the next week or two, the government's going to announce approval for booster vaccines for everybody who's had the COVID vaccinations. And they're trying to decide, they're looking at the studies right now, but they're trying to decide if that's going to be 6 months or 8 months after your second shot. So stay tuned for that. They haven't come out officially with that yet. I'm kind of hoping it's 6 months, but they may be leaning towards the 8 month. But if you're like me, I had my second shot back last January. I'm already at the 8 month point in a couple of weeks. So people are going to be hitting that 8 month point within a couple of weeks of having the shot after after their second shot. So they'll be eligible. I'm gonna be going pretty much the day I'm eligible. I'll be lining up for my booster shot. So and I encourage people to do it as well because the studies show we believe that's going to protect you more against this Delta variant by boosting your immunity.
Dr. Cope, one of the questions that people are curious about is if they did not receive the series, they obviously can't start with a booster, but as you said, all 3 shots are the same, correct?
Right. Right. So if you haven't started your series yet, you can start it. Most pharmacies are still stocking it. You can start it today if you want. And you can start your series. So you would start with, and you still use the Johnson & Johnson. The one shot is still approved, I believe. I think the studies show the Pfizer and Mrna work a little bit better in terms of this Delta variant, the 2-shot protocol. So you could start with your first shot today, your second shot in 3 or 4 weeks, and then your booster shot would be 8 months, 6 to 8 months after your second shot. That would be if you wanted to start your vaccination series today. That's how that would work.
Dr. Cope, will the booster, many people when they had their vaccine series had some symptoms, a day or two after. Will the boosters still do that as well?
Right. So we're just picking up on that because we're just starting the booster shots, right? So we think that, again, that the side effects, you may have a fever for a day or so, a low-grade fever, you may have body aches, you may have fatigue, just achy, but that's usually limited to 1 or 2 days. In terms of the long-term side effects from the vaccine, they're very, very rare. It's a very rare complication to get a anaphylactic reaction to the shot. That's, 1 in, like a million anaphylactic reaction, and that's why they have the ability to treat that right at the pharmacy or wherever you get it with epinephrine. And then the only other thing that they've shown, again, is like several in a million, is if you get the Johnson & Johnson shot, they've associated some increased blood clots for especially younger women. But that, again, is like several in a million people. So it's very, very rare. We still feel like the benefit of the shot outweighs the risk. So we'll see as people get boosters. We think that what it does is it ramps up your immune system to the COVID infection. So you're kind of ramping up your antibodies again. So most likely, a lot of people are going to get the 1 or 2 days of mild symptoms, and then that'll be resolved.
Thank you, Dr. Cope. So we have another question that came in. Does the booster need to be the same as the original series?
They're going to announce that probably. They haven't determined it for sure. I believe if possible, they're going to recommend you get the same shot that you had. But stay tuned for the news on that one because they haven't officially decided yet.
I know, you had mentioned earlier in the conversation, obviously you ask people to put politics aside, if at all possible, and we respect everyone's choice, of course, but many of the things that we've heard is people worry about, it's confusing because this is the mRNA that it affects. And, will the vaccine, you hear the question, will the vaccine alter my DNA?
Right, so this is an mRNA vaccine. Even though this is a relatively new vaccine, this is not really a new technology. They've been experimenting, developing in the labs vaccines against some of the other infections with this for years, working on this technology. The mRNA does not get into your DNA. You know, your DNA is in, if you remember biology class, your DNA is in the nucleus, the center of the cell, and the mRNA is in the kind of the cytoplasm outside the nucleus. So this only ramps up your mRNA to develop antibodies, and it does not affect your DNA.
And we've heard many people, concerned that they feel like, is there a microchip in this? Is there some way to do tracking?
Right. There is definitely no microchip in this. I know that was something circulating around. Is the government using this to track me? And then again, please, I urge you to look at the data. 200 million people now in this country have gotten a COVID vaccine, started their series, and there are no microchips. There's no government way of following you. This is all scientific, and, we are recommending it.
Dr. Cope, what is the concern, or is there a concern for our young women in pregnancy, or either planning to become pregnant, or if they are pregnant and receiving the vaccine?
Right, right. I can appreciate that. I talk to people about this, and I can appreciate your concern, if you're planning to get pregnant or you are pregnant, because you're also making decisions for your unborn child, right? So I can appreciate the concern. I can share with you what we've seen so far with the data that with pregnancy, there is no increase. There is no increased risk of miscarriage with the vaccine. There's been nothing shown to harm the unborn, child, and we are recommending it during pregnancy, and even if you're contemplating pregnancy. But again, I understand, and I talk to people all the time, and I understand your fears and your concerns, and but I could only share what I can see from the data, and then you're going to have to make your decision. But from what we see, it's safe.
What about our young men planning to start a family? Does it have any impact on their fertility?
No, they have not shown any effect on fertility with young males that way.
Thank you. Obviously, whenever people are planning to start a family or pregnant, of course, there's a lot of concerns. We surely understand that.
Yeah, and let me mention too, I think it'd be a good point. Teenagers, adolescents, many of you have adolescents, right? The vaccine has been approved for 12 and older. Um, we initially had seen a very, very rare complication affecting the heart, like an inflammation of the heart. Again, it's several in a million. They've done the studies. They feel that the benefit of the vaccine outweighs the risk. And this is pretty critical right now because actually what they're seeing with this Delta variant is that a lot more teenagers are getting admitted to the hospital. So if you look at, I was looking at the data down in Florida yesterday, they have a couple hundred teenagers hospitalized now with COVID on ventilators, some of them dying. And so this Delta variant seems to be hitting adolescents and children harder than the previous COVID. So again, I know it's a individual choice, but I encourage people to look at the data and to, if I don't have any adolescents in my family, but if I did, I would be having them get that. I had my 22-year-old son get the vaccine as soon as the day he was eligible. I had him go get it. So I encourage you, if you do have adolescents 12 and over, it's been approved. Right now, they are doing the studies to try and get approval for under the age 12, but they haven't approved that yet. So hopefully soon. So stay tuned to the news.
What are we seeing with our children, our under 10 population?
Right. So it seems to be hitting the adolescents more, but there are children being hospitalized with pneumonia, with respiratory infections, being put on ventilators, and unfortunately, several of them dying. I mean, it's still a relatively low number, but it's a spike from where we saw back in January. We really had very few children hospitalized, and now yesterday, Florida actually reported a record number of pediatric hospitalizations for COVID-19. So it is something to be concerned about. And again, I think the theory would be, say you have a child under the age of 12, they can't get vaccinated, and you're trying to decide whether you get vaccinated or not. This is an ideal opportunity for you to get your vaccine to protect your child who can't get a vaccine yet. So the same goes, with your parents, with your siblings. If you're living in a household with your family or extended family, or have contact with them, this is a chance for you to get vaccinated to protect others.
One of the concerns that we see with a lot of questions staff have is, I was positive 2 months ago, or I was positive 6 months ago, and I wasn't vaccinated. How long do I have to wait before I get vaccinated? And does that fact that I was positive, does that give me an immunity for an extended period of time?
All right, that's a good question. So, number one, you can get a vaccine 2 weeks after your infection. You're allowed to get the vaccine. Your immunity, the studies have shown at least 3 months, 90 days, you have pretty good antibodies to the COVID infection after you've been infected. Again, not by the vaccine, but just by going out coming in contact with somebody getting a COVID infection, you're probably immune for 90 days or so. So, we were trying to give advice to our people, and a lot of times what I'm telling them is, well, you're probably safe to wait for 90 days, but I probably wouldn't wait much longer than that to get a vaccine. But you can get it as early as 2 weeks. But if you felt uncomfortable with that, since you just had an infection, you could probably wait 90 days, but I wouldn't wait much longer than that, because you also got to remember that, say you get the 2-series vaccine, you're not fully vaccinated until 2 weeks after your second shot. So it may take you another 6 weeks to build your immunity back up. So I wouldn't wait more than 90 days to get the vaccine.
So I actually had a very good question just posed to us. So we have an employee that was vaccinated, recently tested positive, and we would presume the Delta variant. Now, what is the likelihood that she could perhaps be exposed again and become positive again?
This is somebody who's fully vaccinated.
Yes.
More than 2 weeks after their second vaccine.
Yes.
Right?
Yes.
Yeah. Studies are, going to be ongoing to see that, but I think the studies we would show, if it's similar to the original infection we had when we had the spike last winter into January and February, would be that that person should be protected again for at least 90 days, and probably more. If they've been vaccinated, they may develop more long-lasting protection, 6 months, but the studies are going to be ongoing with that, so we don't really have the data yet.
Mm-hmm. We've had this question come up several times, Dr. Cope. So if I'm vaccinated, will the vaccine itself cause me to test positive?
No, the vaccine will not cause you to test positive because it's a different antibody that the test for than the or antigen that the test for that is not going to cause you to test positive. Now, one of the questions came up, and I've had some people ask me this, is there a blood test I can get after my vaccinations to see whether I have antibody to COVID, whether I still have antibody to COVID? Because maybe then I wouldn't need a booster. Well, number one, they're not recommending people get that test. They're recommending a booster for everybody after a certain period of time, which we're waiting to hear in the 6 or 8 months. However, there is a test there is a blood test, if you're really concerned, that has been developed to show that the vaccine worked. Because the vaccine gives you antibodies to the spike proteins, those little, if you've seen pictures of the COVID, those little red things sticking up around the virus. The vaccine gives you antibodies to those. Some of the labs have developed a blood test where you'd have to specifically request COVID spike antibody blood test. So, if you were really, really concerned or there was a certain situation where you felt like you wanted to have the blood test, you could talk to your primary care provider and see if they'd be willing to order it to see if the vaccine took in some respect. But they don't recommend that routinely, but that is available.
With the Delta variant being so prevalent right now, Dr. Cope, are there other variants out there that we should be concerned about?
There are other variants. Fortunately, they haven't really come into this country to a high percentage yet. There's some down in South America. They're watching all this closely, and they may be coming, but not yet.
Mm-hmm. So if a person is fully vaccinated, what should they be concerned about? Should they be wearing a mask when they go in public? What are your thoughts on that?
Right, because we have these what they call breakthrough infections where you can get a mild case of COVID even though you've been vaccinated because of the Delta variant. I am recommending, and the CDC is recommending, if COVID infection in your area has hit a certain percentage, and like I mentioned now, we're pushing a lot of days 10% locally. Fulton, Schoharie, Albany sees, not quite that percent, but they have many, many positive cases every day because of their large numbers who live in Albany County. Because of that and the rising percentages, we do recommend, and the CDC recommends, that if you're out in an indoor space, shopping, that type of thing, really the recommendation is to put the mask back on and wear the mask indoors. And I know I've been doing that again for several weeks because of that.
Dr. Cope, we were getting several good questions here on the chat. This is an excellent question. Right now, we know that we're talking about the booster with just being one shot. But perhaps what if someone, like myself, I received the series December, January, so I'm already past, I'm at the 8-month mark.
Right.
What if I don't get a booster till December? Will I need just one booster or two?
Right now, the recommendation is going to be just for one booster.
Dr. Cope, we had talked a moment ago about the other variants out there. Obviously the concern is, will that potentially mean we need more boosters, or how does the vaccine help prevent us from getting these other variants?
Right. So the vaccine ramps up your antibodies against COVID. And fortunately, right now, like I said, even against the Delta variant, the vaccine is effective in preventing hospitalization and much less chance of dying from COVID if you've been vaccinated. So we're hoping, but studies are going to have to bear out that these other variants, as they become more prevalent, will have the same effect with the vaccine, that your antibodies will be able to kick in. And most likely, I think most people feel that you're probably going to need a yearly booster shot in the near future for COVID, because of these variants and the need, almost like getting a yearly flu vaccine, right? The flu virus changes every year. They develop a flu vaccine, and it protects you against those type of flu variants that they feel are going to be in this year's influenza. So it'll probably be similar with COVID, that you'll get a COVID shot every year. Whether they're going to come out with new shots, new types of shots, I don't know yet. They haven't, decided that yet. And they might need to develop new shots if they find that certain variants are more resistant to the current shots. But right now, will, the current shots will protect you against Delta, especially if you get the booster, which will be the same shot you got, back 6, 8 months ago.
Mhm, mhm. Last year, I mean, I noticed this, I guess the only upside to last year is that we didn't see flu. And we think that the biggest reason is everyone was wearing a mask, so that the spread, and people weren't going places. So since that's going to continue with a mask, why do we still need our flu shots, Dr. Cope?
Right. So the flu vaccine is still a yearly recommendation. Last year, we did not have a bad flu season, like you said, Kathy, probably because of the masks and the social distancing, the isolation. But I think the point would be that, we want to have an open, free society. We don't want to be in lockdown forever, right? So we want to get rid of these masks at some point, right? So we want to be able to meet with our family and friends and feel safe indoors. So the point would be, we want to protect ourselves against the flu and the COVID. Now, the flu, actually, people may not realize this, but the flu kills, probably on an average flu season year, probably about 35,000 people die from the flu. So the flu is not totally, like a common cold or anything. The flu can kill. So, we want to protect you against the flu and COVID. COVID has a much higher death rate than the flu. And as I mentioned, we lost 1,400 people to COVID yesterday alone in the country. I mean, if that rate keeps up, we're looking, we're already over 640,000 deaths in this country from COVID. And if that rate continues, we're going to be looking at almost 1 million people dying from COVID, which, right now is largely preventable with the vaccine. So I think that's the message I like to get out too, is that, we have the vaccine to 95% of the time prevent a person from dying from COVID. So I urge you to think about that if you're still on the fence about getting a vaccine for COVID.
One of the questions in the chat I can actually help answer. The question was, what are we going to be doing as an agency about providing the boosters? So our plan, and obviously everything is a going forward type thing with ever evolving information, but our plan would be the same, that we will definitely help everyone get the vaccine. Obviously, for the people we support, we will be coordinating all of that. And for our employees, we'll be doing the same. We did not actually have receipt of the vaccine earlier this year ourselves. We have the ability to do that. We have the storage, refrigerator, and freezer. But there was an allotment. You had to have 100 doses and use them within a week, and it's use it or lose it, and you might not get it again. So because we had the availability to get them for all of you, we chose not to do that. So we're going to be looking to possibly obtain and have our own vaccine, but we promise we will do everything we can to make sure it's available to everyone as quickly as possible. So don't worry, we got you. This is another good question. Why did New York State, make the decision, Dr. Cope, to mandate the COVID vaccine the way it's doing it, but yet there was choices with regard to the flu shot? Why the different approach?
Right. So, this is kind of a hot topic right now. And, again, I can appreciate people's feeling that, I have constitutional rights, I have the right to freedom, the right to choose. And um, I think with the data coming out, and especially in a healthcare environment, um, they're seeing with this Delta variant such high rates. Initially, they did not mandate COVID vaccines for healthcare workers, but now with this Delta variant out and so many infections again rising, the death rate rising, the hospitalizations rising, putting the strain on the healthcare system. Healthcare workers are a primary force to help treat those people, right? So if you're working in an office, a medical office, a hospital setting, you're on the front lines, and if you go down, who's going to be able to take care of those people? And also, you come in contact with other sick people. Somebody comes in with an unrelated problem, but a similar, sickness where their systems are weak, and then you get COVID from a patient because you didn't have a vaccine and give it to this other patient who then dies. That's a horrible tragedy. So the decision was made, and I know it's a tough decision because a lot of people are upset about it. And but the decision was made that by the end of September, that for healthcare workers, the vaccine is going to be mandated. There are some very limited medical exemptions, but they say they're going to be very limited medical exemptions for that. Now, it's not that much different than if you work in a healthcare setting, you need to have immunity against hepatitis B, you need to have immunity against measles, mumps, rubella. These things have been taking place for years against TB. So there are other mandated type tests that people have had to get, that you've had to get these vaccines to protect you against measles, mumps, rubella, hepatitis. You've had to get a yearly TB test if you're in a healthcare setting, because those infections can be rapidly spread in a healthcare setting. So it was a tough decision, and I appreciate people's concern about it. But I think the Department of Health feels like they need to protect people in the healthcare setting too, so they mandated this.
Yeah. Um, but you had mentioned this earlier, Dr. Cope. As far as flu, what we see with flu, um, historically, flu has not affected the same volume of people. I think, what number did you say, Dr. Cope, was?
Yeah, about 35,000 people a year on a typical flu season die from the flu. Now, we're at 640,000 over the past, since this COVID started, dying from COVID. We're losing, 1,400 people a day this week, 10,000 people this week. That's what, 40,000 people a month. If that trend continues, it's much more, has a much higher death rate, chance of dying from a COVID infection than dying from the flu.
Mhm. And I was sharing this with someone yesterday. We don't do research and do studies here. We're not able to do that. But I can tell you from memory and experience here, in all our years of dealing with flu, we've only lost a couple of people to the flu altogether in 30
Right.
plus years. We lost 7 people from COVID within the past, well, now it's been over a year, but with the COVID
Mm.
that we've seen. So definitely that is a stark contrast, to say the least. I have a couple more questions, Dr. Cope. Hold on, I just have to scroll back up. One question is Lexington going to mandate the vaccine? So Lexington itself does not make those decisions, So OPWDD, which is obviously, as you know, our oversight, is currently reviewing this. There's been no decision made at this point. So, unfortunately, we don't have the answer to that question. But I will tell you that obviously it's something that we're deeply concerned about, and it's something you can talk about from both sides of it. Of course, we want to protect all of you and protect our people, but we also respect people's rights. So we don't know the answers to those things, but we promise to keep you informed as soon as we do know. Dr. Cope, why are we seeing such high rates here in our Fulton County in particular, but even, Montgomery, Schoharie, Albany? Why are we seeing such high numbers?
Right. So I think, and the government had said to us, CDC said, well, if you're vaccinated, you no longer need to wear a mask, right? So that came out a few months ago, and we were all happy to toss the masks when we're in the stores and all that, right? So they made them optional. So I think we kind of let our guard down a bit with that, and quite honestly, I think if you shop in Walmart or you shop in a grocery store, very few people were wearing masks during the summer, right? And we know that statistics say that probably at least 30% of those people were unvaccinated, but they weren't wearing masks, right? So kind of everybody tossed the masks. So that kind of contributed to this spreading. And then the Delta variant is so much more contagious than the regular COVID. I mean, it's really pretty alarming when you see some of the numbers. I mean, they had a study came out from Cape Cod, a town in Cape Cod during the summer, where like 900 people got the Delta COVID within days of just vacationing in restaurants, bars. It was alarming, the rate, and believe it or not, 70% of those people were vaccinated. So it was very highly contagious, even causing these breakthrough infections to vaccinated people. Fortunately, again, of those 900 people, very few were hospitalized, and as far as I know, I don't think anyone died. But because they were so highly vaccinated. But this is very, very contagious, so that's why we're seeing the spike.
Mhm. Absolutely. Um, why is it so important, Dr. Cope, for us to report any symptom when we come through as a screening, even if it's just a sniffle?
Right. So, this Delta variant, what I tell my patients in the office is if you get we're seeing a little bit of a difference between the Delta and the regular COVID, especially if you've been vaccinated. So we're seeing if you see a slight sore throat, runny nose, or headache, guess what? That's a good chance that's the Delta COVID. So, I mean, we can't differentiate between a common cold and that, but that may be all you have. Is a slight sore throat, slight runny nose. Half the days I wake up and I've got some allergies, and like most people, the pollen count's very high, and you got little sniffles, and I'm concerned, do I have could I be coming down with this infection? But, if it's something a little bit out of the ordinary, if you've got daily allergies and the pollen count is very high right now, and, you've got a little runny nose every day just from allergies, that's one thing. But, anything out of the ordinary for you, even if it's a slight sore throat, slight runny nose, nasal congestion that you don't normally have, or headache, or certainly cough or fever. But, a lot of times we're seeing very mild COVID cases. So it's important to report those when you do go into work so that we can do that screening and protect the people we support. Yeah, I think better to err on the safe side. We have a great rapid testing system, right, Kathy? So, we'll test you. If you're sick, we'll test you, or we'll get you tested. We'll get you to your primary care provider or an urgent care center. We'll get you tested, but better to err on the safe side.
So that kind of piggybacks into one of the questions was we support a large number of folks that live home in the community with their families, and not all of them are vaccinated, and they can't all wear masks. They don't all tolerate that. So how do we know that we're protecting ourselves as best when not knowing what their home life is like?
Right. So I guess that's an extra reason, realizing that a lot of the people we support cannot adequately wear a mask. You know, either their nose is sticking out, you know, no matter how many times I know we're constantly reminding people, pull it up over your nose. But they're not really able to adequately wear the mask properly. And that's more so the reason for you to make sure, you know, you're protected with the vaccine, with the mask. And so I think that just gives us that extra push. We have to protect ourselves and protect our families and protect us from spreading this, because a lot of the people we support really can't do that for themselves.
Absolutely. Absolutely. Um, we had talked, just a brief run through, we had talked earlier, Dr. Cope, about the boosters and, you know, learning, you know, if you've had Moderna or Pfizer. What about the Johnson and Johnson? That was a one shot thing. Would the booster still be one shot, or how will that work?
Right. So they're studying that right now. They most likely are going to recommend the booster for the Johnson and Johnson. They're looking at the data. I've read certain things saying that they might recommend that everybody who had a Johnson and Johnson now get a Pfizer or Moderna, but they haven't decided that for sure. One thing I do want to bring up, because I hear this from time to time, is that the vaccine, is it FDA approved? So 2 weeks ago, the FDA approved the Pfizer vaccine. So the Pfizer vaccine has full FDA approval. So if you or some of your family members have been hesitant to get it because it wasn't FDA approved, please, that barrier has been removed. Please think about getting it for that reason. It is fully FDA approved. The Pfizer, the Moderna should receive FDA approval in the next week or two, and then the Johnson and Johnson should receive FDA approval, you know, shortly after that. But right now, the Pfizer has had full FDA approval. So when they, the next coming weeks, when they recommend the boosters, they're going to specify, you know, based on what you had, whether it was a Johnson and Johnson or Moderna or Pfizer, there'll be a recommendation as to which one to get.
Thank you, Dr. Cope. Our town hall time frame is coming to end in a few minutes. Does anyone else have any other questions or any thoughts they'd like to share? I did get another question. So if I had COVID in the last 90 days and I'm recently exposed again to someone who tests positive, is it likely I'll test positive again?
You won't test positive again unless you get an active infection again. Now you may have very little symptoms, but if you test positive for COVID again after 90 days, then you potentially could be spreading that to other people. So, you know, that would be considered an active COVID infection, and you would have to protect yourselves, stay home, isolate yourselves from your family, stay home from work, that type of thing. You know, we would recommend all the routine things we do for a COVID infection would kick in.
Thank you. I don't see any more questions. I just want to thank all of you for taking an hour out of your time to come join us. I hope that this was helpful. We cannot say thank you enough to all of you for all you have done and continue to do. You're all amazing. We've put so much on you, but you've done it all with the greatest of intentions, the biggest of hearts. You're the most caring group of people I think that exists.
Right.
And thank you, Dr. Cope. You are absolutely wonderful. I don't know if you all know this. Dr. Cope is available 24/7. Always there for us, and we just are very blessed, honestly,
Yeah.
Dr. Cope.
Yeah, I also want to reiterate what Kathy says. I thank you, you know, for your care of the people we support. Some people may not realize this, but I have two brothers who live in Montgomery County, so they're in Liberty ARC residences, and you know, both Liberty and Lexington. You guys go above and beyond, and the direct care, and I see it day to day. I was just visiting my brother's home this weekend, and it's just amazing the care that you provide, and I really appreciate that. So thank you.
Yes, and we had one last question I just want to answer before we go.
Yeah.
Are we going to go to full PPE? So at this time, we're using KN95s whenever you're working with the people we support, um, and then surgical mask if not, if in the office settings, unless, you obviously have a choice. You can wear a KN95 if you choose to. We don't have an issue with that in the office setting. We're constantly assessing what we're doing. It's one of those things you wish you had a hard, fast answer, but the answer today may not be the same answer 2 weeks from now. If we were to see a high spike of infections, obviously we have to step back because we have a duty to protect everyone. So it's a constantly evolving answer, I guess. I will say if we're in the event where we're dealing with a situation where individuals that live in the home are COVID positive, we will be wearing full PPE, including N95. So we will adjust as we go. But thank you again. Wonderful questions. And Jeannie said thank you. You're most welcome. We truly appreciate all of
Yeah,
you.
thanks. And if there's any other questions, Kathy can get me questions and I can respond to them offline and I'll be happy to help you.
Absolutely. And if anyone wants vaccine or wants to know more about it, just let me know. You can all email me. You can give me a call here at Burke. We will get whatever information you need. Thank you all. I hope you have a wonderful rest of your day.
All right, take care.
Take care,
Bye-bye.
everyone. Bye-bye.